I will share a fever-reducing manipulation called beating horse across the heaven river, which is quite common. This manipulation can be used regardless of whether the child has a cold-induced or heat-induced fever. As soon as the child starts to show signs of a fever, you can use this manipulation. To begin, prepare a cup of cold water at room temperature. We usually choose the child's arm, focusing on the area along the lung meridian. In this manipulation, we perform single-direction tapping toward the heart. First, dip your fingers in the water and apply it to the child's arm. Then, while tapping, blow on the arm at the same time. You can use 2 or 3 fingers to tap from the wrist joint up to the elbow joint, while continuously blowing on the area. It's crucial to remember to tap and blow simultaneously. As you feel the water evaporating, you can apply more water and continue tapping. The characteristic of manipulation is that it can lower a high fever, such as 38 degrees Celsius, down to 37 degrees Celsius within 2 to 3 minutes of manipulation. If the fever recurs, it usually won't exceed 37 degrees Celsius. You can perform this manipulation on both arms, and the tapping can be repeated as needed. This is the beating horse across the heaven river. Remember, always tap in the direction of the heart, in a single direction, while blowing on the area. Let's move on to the second quick fever-reducing manipulation, called the 4 key acupoints for rapid fever reduction. The first one is the yin-tang acupoint. Starting from between the eyebrows, push upward toward the top of the head in a single direction. This is called opening the heaven gate. The second one is pushing the superciliary arch. It also starts from the middle of the yin-tang, pushing from the inner ends of the eyebrows out to the tai-yang acupoints. The third is rubbing the tai-yang acupoints. The fourth is rubbing the high occipital bone behind the ears. For these 4 acupoints, I usually pair them with pinching and lifting the dazhui acupoint, which makes the effect even faster. I'll demonstrate this for you. When a child has a fever, I recommend doing about 300 to 400 repetitions on each acupoint. You can use both hands to open the heaven gate, and then push the superciliary arch. When performing these manipulations, since the goal is to reduce heat, I suggest doing them quickly. The faster motion creates friction and heat, which helps the child to sweat more quickly. The third acupoint is when doing this on a child, we generally recommend gently rubbing and pressing, but you can increase the frequency slightly and cover a larger area. Tai-yang acupoints. The fourth acupoint is rubbing the high occipital bone behind the ears. Let me show you. This area is behind the ears, often referred to as the fengqi point in adults. In children, the occipital bone is more prominent, and there's a high ridge where the fengqi acupoint meets the occipital bone. We rub and press this high ridge area using about 3 or 4 fingers on both sides simultaneously, lifting and pressing upward. Usually, by the time you finish rubbing the high occipital bone, the child will start sweating at the dazhui acupoint. This completes the 4 key acupoints for rapid fever reduction. After rubbing the high occipital bone, we move on to the dazhui acupoint. Place your thumb and index finger on the dazhui acupoint, lift upward, and rub and press this area. You can also lift upward from this position. This process encourages the child's body to sweat, leading to a quick reduction in fever.